Welcome to my channel. Each woman may experience vaginal discharge at different times during pregnancy. This discharge primarily helps maintain the reproductive system by cleaning some dead cells from the genital tract. Additionally, it protects the reproductive system from various infections caused by different microorganisms. Many women get worried after seeing such discharge during pregnancy. So, in today's video, I will discuss why does white discharge occurring during pregnancy, what should we do when white discharge occur during pregnancy, when to consult a doctor. So, let's get started. Why does white discharge occurs during pregnancy? When a woman becomes pregnant, her body undergoes various hormonal changes, especially an increase in estrogen and progesterone hormones. Additionally, during pregnancy, there is an increased blood circulation in the pelvic area and the vaginal canal. As a result, there is a comparative increase in vaginal discharge. The white discharge during pregnancy helps maintain the cleanliness of the reproductive system and protect it from infection. However, in some cases, various infections can also cause increased vaginal discharge. Now, the question is how to understand whether your white discharge is normal or abnormal. Normal white discharge may appear somewhat thick, clear, or milky white, and sometimes creamy white. It should not have any strong odor or contain any clumps. The quantity of normal discharge is usually 2 to 4 teaspoons per day. So, it should not be enough to soak through your underwear. Therefore, if you experience this type of white discharge during pregnancy, there is no need to worry. It is entirely normal. When will you know you are having an abnormal white discharge? Number 1. If your vaginal discharge is watery or has a yellow or greenish color, it may be a sign of infection. For example, trichomoniasis is caused by the Trichomonas vaginalis parasite and is primarily considered a sexual transmitted disease. Other symptoms of this condition include abnormal discharge that like more than usual, itching in the genital area, pain or discomfort during sexual intercourse, burning sensation during urination. Number 2. If your white discharge appears like cottage cheese and has a foul smell, it could be a yeast infection. This type of infection is primarily caused by fungus. Treatment usually involves antifungal medication prescribed by a doctor. Number 3. Grey discharge is generally not a good sign and is often associated with bacterial vaginosis. Other symptoms of bacterial vaginosis may include a fishy odor, a reddish or inflamed vulva, and itching. Bacterial vaginosis can be effectively treated with medication under the guidance of a doctor. Number 4. If you experience clear watery discharge during pregnancy and quantity is significant enough to require the sanitary pads, or if your undergarments get soaked, it may not be white discharge but rather amniotic fluid. During pregnancy, the baby is surrounded by amniotic fluid inside the amniotic sac. Sometimes the sac can rupture, leading to a leakage of amniotic fluid. This condition is known as prom or premature rupture of membrane. If the amniotic sac ruptures too early, it can lead to complications such as growth retardation and premature delivery. So, if you have white discharge during pregnancy, you need to keep something in your mind. Number 1. If your discharge is thick, clear, milky white or creamy white, does not have a strong odor, and the quantity is within a normal range, it likely normal discharge and there is no need to worry. Number 2. If the discharge is excessive to the point where you need sanitary pad or your undergarments get soaked, if the color of discharge changes such as become greenish or yellow, or if your white discharge appearance look like cottage cheese, it could be sign of infection. If you notice discomfort, itching, burning, or any unusual sensation during sexual intercourse, it could be an infection or underlying issue related of the discharge. Again, consult a healthcare professional is essential. 5. If you experience pain, burning, or discomfort during urination or have any abdominal pain, fever, or other unusual symptom alongside abnormal discharge, it could be sign of infection or a more serious issue related to the pregnancy. Do not delay to seek medical attention in such case. If you experience many of these symptoms, seek the promote medical advice. Now discuss the what should we do when what discharge occurs during pregnancy. Number 1. Keep your genital area clean and maintain good personal hygiene. Number 2. Avoid using antiseptic or soap in the vaginal area as they can disturb the natural pH balance. Number 3. After sexual intercourse, urination and clean the vaginal area with water to maintain sexual health. Number 4. When using the toilet or wiping after bowel movement, always wipe from front to back to prevent infection. Number 5. Drink an adequate amount of water daily, at least 12 to 14 glasses of water to stay dehydrated. Number 6. Use breathable cotton underwear and change them gradually. Avoid using tampon to extend discharge, but you can use sanitary pad. Number 7. Please add fruits and vegetables in your diet, especially food like bananas and yogurt, which can promote good vaginal health. Number 8. Please do regular exercise and physical activity like walking and swimming. These guidelines emphasize the importance of maintaining cleanliness and following the healthy habit during pregnancy to minimize the risks of abnormal vaginal discharge and infection. Always consult with your doctor for personalized advice and guidance during pregnancy. No more today. I hope this video was helpful for you. If you find the video helpful, please don't forget to share it with your friends. Please subscribe to my channel for get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.